Welcome, everyone. I'm so excited to kick off the conversation today about being your own advocate, how to navigate fibromyalgia care. We're joined by amazing guests today, Melissa Talwar and Brandi Privitera from Support Fibromyalgia Network, an amazing patient advocacy organization, as well as Dr. Andrea Chadwick from Swing Care to talk from both a patient and provider perspective on how to advocate for better fibromyalgia care for ourselves. So just to start things off, I'll share a little bit more about our guests and then we'll get into the conversation. Melissa Talwar is the co-founder of Support Fibromyalgia Network, nonprofit organization, and a board-certified functional medicine health coach working in group medical care. She was diagnosed with fibromyalgia at 14 years old and spent over 20 years declining in the medical system with no hope of improving. And then in 2016, she found help again through biohacking, functional medicine, and her own research. And Brandi Privitera is the blogger behind Being Fibro Mom, which she created in 2013 with the hope of helping fibromyalgia sufferers become fibromyalgia thrivers and advocating for parents enduring the hardships of fibromyalgia. She's also the Family and Fibromyalgia Program Director for Support Fibromyalgia Network. So thank you both for being here.
Thank you.
Thank you.
And Dr. Andrea Chadwick is the Medical Director of Swing Care and is double board certified in anesthesiology and pain medicine. Her clinical expertise focuses on complex centralized pain syndromes, including fibromyalgia, and she's the director of the Fibromyalgia and Centralized Pain Exploration Lab at the University of Kansas Medical Center, which is a whole lab, the research lab dedicated to fibromyalgia. So to start things off, maybe Melissa, we'll start with you. I'm wondering if you can share a little bit about your story about how you became an advocate for your own care.
I didn't even know what an advocate was, so I was kind of thrust into it with all the adversity I faced getting a diagnosis so young, and then also being told that fibromyalgia patients aren't that young. So it was very confusing and having to try to survive. I basically had to learn how to be an advocate for myself in my own clumsy way. Eventually, I started to do more volunteer work and I figured out that there was a space for patient advocacy. And then, of course, meeting Brandi really energized us to form the Support Fibromyalgia Network, which really launched more advocacy efforts across the board for the fibromyalgia community.
Yeah, thank you so much for doing that. It's amazing to have people like you in the fibromyalgia corner. So, and Brandi, I'm curious with you, how did you start kind of advocating for your own care, and how did you connect with Support Fibromyalgia and Melissa?
There were a funny story that Melissa will have to share at some point. Actually, when I started having an onset of fibromyalgia symptoms, I had just had my first child. And so a lot of my symptoms were just attributed to being a first-time mom. I did have an infection that had overtaken my body, which kind of forced me into early labor. And so everything that I was having, all those fibromyalgia symptoms, was just passed off as the infection, and then later on as just being a first-time mom. But after years of just not getting better, I decided, I just can't do this anymore. This is something more that's going on. And so I just decided right then and there that I was just going to keep fighting until I figured out what was going on with me and get some answers so I could live better, because I wasn't living very well at all. And so I went to my provider through the VA at the time, because I'm a disabled veteran, and I just, broke down in her office and told her that all these things were going on. And she lived with fibromyalgia herself, and so she recognized all the symptoms, and immediately she was just like, I think you're living with fibromyalgia. Let's make sure it's not any of these things first, because fibro can mimic a lot of stuff, but I think that's what you're living with. And so we decided that, after all this testing and everything, that I was living with fibromyalgia, and I went onto the internet to try to find some resources about how am I a parent and supposed to manage my fibromyalgia symptoms, and I couldn't find anything. And so I was like, you know what, I'm just going to start sharing my experience and just see what happens. I never thought I would become an advocate. It wasn't until I connected with Melissa and we started talking about advocacy, and then one day it just dawned on me a few years ago that I was like, oh my goodness, like I'm an advocate and I'm doing all these things, and I never thought that it would come to this. And it's surreal and just amazing.
I love that story that goes from, not having kind of anyone in your corner to having this whole community of people. And I think that's really what it's all about, both finding that community and then also bringing it to wider visibility outside of the community. So thank you both for everything that you do. And Brandi, I wanted to kind of start with that story. People are often kind of thrust into being their own advocates because no one else is. And a lot of times it kind of starts with that provider who recognizes maybe they have treated fibromyalgia patients in the past, or maybe they have fibromyalgia themselves. But for people that don't have a provider like that or haven't found one, what are some of the questions that you find really helpful in kind of bringing up with your provider when you're kind of starting to, maybe you've just gotten a diagnosis? And Dr. Chadwick, I'd love to hear that from your provider's perspective too, but starting with Melissa and Brandi.
I don't know exactly, because I believe that it's all unique compared to, whatever you're just going through at that moment. Like at that moment, that I was telling my provider, like, I need help and what's going on with me, it was because I did not feel like myself at all. I was completely disconnected from myself and who I was. It was more than just about the symptoms. It was just truly losing who I was. And how did that play in to all these symptoms that I was having? Can we pinpoint it to something that's, physically happening, that's taking this mental, strike against me? I don't know how else to describe it, but mentally I was in a lot of pain and suffering. And so it was, I guess, just trying to figure out what is physical and what was mental, because it was all feeding into one another. But the only thing I can really say is to not give up on yourself and not to doubt yourself. Because when I sat down in front of that provider for the first time and I said, hey, something's wrong with me and I'm tired all the time. And I went from like a very active person in the military to being the complete opposite. And him telling me, no, you're just a mom, and me just being quiet and saying, okay, and accepting that, I shouldn't have done that. I should have said, no, something's wrong with me. Let me find someone else who's going to listen to me. So I think it's just a matter of just speaking up for yourself. And I don't know if that completely answers your question, but for me, it was more of mental anguish than the physical, because it was like I had physical, but then I kept being dismissed and being told that it's nothing. And so I kept pushing it inside. I saw myself as very weak and less than, and I couldn't do everything else, and that all moms was going through this and they were just better than me. And that did something to me spiritually and just mentally, and it beat me down and made me someone that I was not. And that's what I don't want other people to go through. And so when I think about advocacy, that's what I really look at, is like the person themselves and what they're going through mentally and all that, anguish that they can go through. So just don't let someone just tell you no, just trust your gut.
Yeah, and even knowing that that is accessible and available to you, I think hearing stories like yours and being involved in a community like Support Fibromyalgia Network helps you recognize that you're not alone in this, and that you do have other people who have gone through very similar experiences. Melissa, did you have that kind of experience with a provider? So I know you were diagnosed very early, and so I'm curious, kind of after that diagnosis, how you kind of sought out better care.
I was pretty much a very confused patient. So that's why a lot of this advocacy comes in with like organization and how to approach talking to doctors, maybe in a more organized way or a methodical approach to it. And there's always something now that I've learned that can be done. And I think we have to remember that medical providers are our actual allies in this. Unfortunately, the system has been designed to kind of put a wedge between the patients and the medical providers, but I do believe we can bridge this gap. That's why I love this conversation. So even though I felt dismissed, I wasn't really aware of some of the tools that I could be using in order to better communicate to my medical provider and what to do. I mean, it was a lot to like manage. And I didn't know, when you're taking on even medications, how to communicate that, or you're going to one specialist and you're only telling them, maybe if you're at a GI specialist, only relating the GI information, but yet you're on multiple medications already. So how do you collectively organize this, even for a primary care physician to come in and have a good conversation? So that's a huge part of what I like to share with patients, in helping getting them organized, understanding maybe what you're walking into, understanding a doctor's strengths, because there's different strengths, but there's always something that you can do even in a primary care setting of getting your labs ordered, referred to specialists. So these are the types of conversations we continue to have.
Yeah, and Dr. Chadwick, kind of from the provider side of things, what is helpful to have from a patient or hear from a patient in maybe that kind of first appointment after a diagnosis where you're exploring personalized treatment options?
I mean, I feel like there's a lot of really great things that have been said, and I would like to highlight that there are patients who have experienced medical gaslighting throughout their journey towards their diagnosis, because I think many times providers don't understand the pathophysiology of fibromyalgia, and B, I do think there can be a stigma towards a woman presenting with multiple symptoms that may be physical, and may have something to do with how she's functioning in life. And I think it's really important to put light on the fact that there are situations where there are negative interactions between patients and providers. And I think there's a real learning point for providers when it comes to really just having an open ear for their patients, allowing them to speak their truths and allowing them to provide their journeys to a provider. Because I have found that when it comes to the best conversations I've had with patients, whether they have the diagnosis of fibromyalgia or not, it's providing them a voice. It's giving them the soundboard, the ability to share their story, and then taking information from that story to guide me towards a differential diagnosis. And I think that's oftentimes lacking in the current medical system. So often providers are faced with seeing patients in a certain amount of time, only having the ability to talk about certain things. Say, like if they're coming in for their regular well woman exam or well man exam with their primary care provider, oftentimes patients are told they can't bring up issues that are acute for them or concerning to them because these are not part of the typical well woman or well man exam. And so there's a lot of barriers for patients, and I think even a lot of barriers for physicians to be able to identify these issues and address them in a timely fashion. So when I talk to my patients about advocating for themselves, and again, I have a practice that's dedicated to fibromyalgia, so I have a very open and honest and wonderful space for patients to get the care they need. But I recognize that may not be the case for all of my patients. And so let's say I'm talking to a patient who has fibromyalgia and they're needing to go explain symptoms to another provider, another specialty that is pertinent to that. You know, we discuss how do we present this to that provider so that we can have a focused physical exam and history, but also take into account all of the other things that are going on. So when I have a patient who may be describing symptoms of irritable bowel, for example, and it hasn't been diagnosed before, but they've already got a fibromyalgia diagnosis, I'll be referring them to gastroenterology, and I'll say, you know what, it's really important when you meet with this provider to discuss your GI symptoms, but you also need to describe your fibromyalgia. Because let's say a patient comes to me with irritable bowel and they don't have a diagnosis of fibromyalgia. If they start describing to me widespread pain and they tell me they have irritable bowel, I already have that little like voice in my head saying this could be fibromyalgia because they have irritable bowel, and we know these are co-occurring pain syndromes. So I think it's really important, as Brandi and Melissa have stated, that using that platform, that voice, that space to provide a very I would say like directed conversation is really important. But I would also say that on the provider side, you have to have that space open and free of judgment to be able to listen and receive what your patients are telling you.
Thanks so much for sharing from that perspective. And one of the things you mentioned that I hear very frequently is that it's very hard to hold space for talking about fibromyalgia with a provider because either they don't have enough time, they're very limited in terms of what they can talk about, or there's other things going on, other conditions that maybe the doctor wants to address more immediately. Maybe it's a more acute need. I'm curious from any of you, if you have techniques or ways of talking about fibromyalgia that does create an entry point for that conversation, even in the limited time that you do have, especially maybe with a primary care doctor.
Well, I mean, I would love to hear from Dr. Chadwick more on how to help in those situations, because it was a challenge even for me personally, because I really thought something was wrong with my brain. So I had been diagnosed with fibromyalgia, but I was getting a lot of severe brain symptoms. So it was a challenge for me because every time a lot of people wanted to focus only on the thyroid. And I'm just like, my brain is going kaput. I can't function. I can't find my way home. But it was a challenge to speak up and advocate for myself in those time periods to get those types of tests ordered, like something is wrong. So, I mean, it'd be great to hear from Dr. Chadwick on how to, in those situations when stuff is coming up and you need a little bit more discerning between fibromyalgia and some other things.
This is a struggle for all of my patients. Trust me, I have so many people, very like established patients of mine who are like, I'm having these really distressing symptoms, but I don't know, like my primary care just won't listen to them. And usually it's the other way around, where they already have the fibromyalgia diagnosis and I'm seeing them, but they're having other concerning symptoms that are then actually, in my opinion, falsely attributed to fibromyalgia when they actually could be other medical conditions. And I think where this conversation is important is really just stating, like, you can have fibromyalgia and have other things going on, but you can have other things going on and also have symptoms that are related to fibromyalgia, and they're not mutually exclusive, right? So you should always be looking for other causes of symptoms. I can tell you very clearly when I have patients come to me and tell me symptoms that are not fibromyalgia, but they've been told they are, that I'm like, actually, we need to investigate those because those aren't in line with what I have knowledge is attributed to fibromyalgia and what is not. Now, there are plenty of patients who come to me and they already have fibromyalgia and they have these other symptoms. It's like, well, those could be fibromyalgia, but they could not be. So really having that ability to go to a physician. And again, I realize I'm lucky in my space to be a specialist where people can come to me. But when it comes to a primary care provider, I think really it's stating, listen, and in your example with thyroid, I know I have thyroid disease, but based on my recent laboratory examination, I'm euthyroid, right? And so then it's like, I also am having symptoms of fatigue, brain fog, and I know I have a diagnosis of fibromyalgia, but yet I'm euthyroid. So if I'm euthyroid, we cannot blame my brain fog on my thyroid disorder. And therefore, I think this may be related to my fibromyalgia being under poor control. So can we talk about either ways that you and I could address my fibromyalgia? Or if you aren't up to date on the latest literature of fibromyalgia, I would really love for you to refer me to someone who might be up to date on how to treat fibromyalgia in a variety of different ways. And I think it's not stating to a primary care provider, like, you're not up to date on fibromyalgia. It's a way to just say, listen, I recognize you're dealing with many medical conditions that I may have, but they're all under control. And if I'm still having these other symptoms and they are in line with fibromyalgia, this is where I'd like to focus my attention. And if you are not able to focus your attention there, either due to time or knowledge or not being, up to date on the latest literature, then I would really love it if you could provide me a referral to someone who is. And I personally don't think a primary care provider would take offense to that. But then again, you never know.
Yeah,
I
I
really
appreciate
love this
you.
conversation.
I really appreciate you sharing that. And I think there's so many ways that we can kind of begin just through our language to have that conversation. Sometimes it's just a matter of thinking in our head, what's going to be the easiest way for me to bring this up in terms of the language that I use. And that's on the provider side too, where one thing I remember hearing in a Medical Pearls conference was just a provider saying, instead of, do you have any questions? What questions do you have? And that just opens up the conversation. And so being able to think about the words we use and the language we use just to free ourselves up to open that space can be really helpful.
And I think it's important. I can say as a provider, I have noticed sometimes when my patients are overwhelmed in an examination or a history. I just actually saw a patient yesterday who was very flustered because they had long COVID in addition to their fibromyalgia diagnosis. And I could just tell that she was very overwhelmed. And I saw that she actually had a list that was sitting on the table and she wasn't referring to it. And I noticed it there and I said, I can tell you're having a hard time communicating with me right now. I see you have a list on that table. Would you like to bring that out and we can talk about it? It's little things like that people can pick up on to help patients in those moments where maybe they're having a little bit of white coat anxiety, or maybe they're having some brain fog, or maybe they're just emotionally overwhelmed with what life is bringing them. But I'd like to hear from our patient advocates. I can share my side, but in a patient perspective, in those visits, how can you sometimes take a provider who might have their head in the clouds and bring them down to earth?
Yeah, I was actually going to say that it's all about mindset. And I know that I've said that a lot, but really that's where a lot of it is for me. And just hearing y'all talk about this, it's reminded me of a lesson that I had to learn a few years ago. Was it's all about how my energy and my mindset is going into an appointment. I have severe anxiety when it goes into an appointment, and it's because of many things. It's because I've been dismissed so many times and minimized so many times and just pushed away that I immediately go, like, my anxiety is going up just talking about it. I immediately go into an appointment where I don't want to talk. I immediately want to shut down because I already think preemptively they're just going to dismiss me and they're not going to listen to me. So it's like, how can I get this person to listen to me and not think, to hate to say the C word, crazy, like that I'm legitimately having issues, that I'm not just manifesting all these things on my own. And so then I start getting in my head and I start thinking about that. And then I start to get angry, and I get angry at all those past medical professionals that have shut me down, and I start projecting it onto this individual who I've never met before. And I go through providers so much just because the VA they change out providers without even telling me. So by the time I'm actually getting to know a provider, I'm already being changed by another one. And so what I've learned is that it's the energy and mindset that I bring into the room. Okay, I don't know this person, this is a human being. Let's just give this person a chance to listen to me. Not all medical providers are going to be like this. It's not fair of me to say, oh, you're going to be like everyone else. Just give them a chance to listen. Just like I want a chance to be listened to, let me give them a chance to listen to me, and let me try to just calm myself down. And so I try to calm myself down. And, I try to take that list. And I love that you said that you saw that list and you saw that she was struggling. Like, for me, emotionally, that appealed to me because I wish that I have been in a situation where I've had my list and I'm sitting there with my little list and I'm like, oh man, I forgot to talk about my list because I've had so many other things going on in my mind. So I love that. But yeah, just having that different mindset is saying, okay, give this person a chance to listen to me. Let's listen to what they have to say, and really clearing the mind and just letting them just focus on one question at a time. And without even realizing it, I don't even talk about fibro immediately. I had hives last week and I went to the ER, and I could talk about everything else, but I did not talk about fibro because it was just instinctual just to not talk about it, because immediately they're just like, okay, what pain meds do you want? This and that. And that's not what I wanted. And so I'm working on that to try to talk about that more because, like you said, Dr. Chadwick, it could be related to what I'm currently going through, but I'm working on it. But having that clear mindset, to just giving that provider a chance to, be different and be able to actually help without shutting them down, and giving them a chance just like we want a chance as well.
Well, and I think the fact a lot of patients of mine come with lists, and a lot of it is just because of their brain fog that they've been making that list between visits, and they need to talk about it. And so something I've advocated for my patients is to say, you know, I'm coming in with this list because my fibromyalgia sometimes makes it so my cognitive structuring is not to the degree that a person without fibromyalgia experiences. So would it be okay if we talk through my list of concerns so that we can adequately address the issues I'm coming to see you for today? So those are some of the coachings I do with my patients. And I have found that that helps them be able to feel a little bit more in control of their medical consultations. But I would like to just say, on a provider standpoint, for any providers who might be watching this, that you need to be able to recognize cues within your patients. And if they have a list and you notice they're not looking at it, that it's a respectful thing to notice that they have a list and say, hey, I see you've brought a list. It'd be really great if you wanted to reference that during our discussion. So I think the road goes both ways.
And what we're trying to do is fill in the gaps. So both educate medical providers, and then also where do the patients fall on the education side. So I would love them not to be necessarily having driven into medical expertise. We want them to come and be a patient, but I know this is a challenge and something that comes up at our organization a lot, especially when I talk and people ask about my background, because I went to the extreme. I bought blood chemistry panels. I looked at, studied on how to review MRIs and all of that. So I became this medical expert, and I can't expect all patients to do that. So where is the middle ground between the communication with patients and providers? So I think it's important.
And that's something I wanted to ask about, you know, when we're talking about this list, often people are forced to be the fibromyalgia expert in the room. Certainly they're the expert in their own condition, but often they're also the expert in treatments and new research and what's going on. And so I'm curious, Brandi and Melissa, when you're looking for new things, potential new treatments to talk about with your provider, where do you start? Where do you get some of that information? Or where would you recommend that patients go if they're looking for something to talk to their doctor about, or exploring, maybe researching it for themselves?
So we have a challenge across the board on references and finding those references. And sometimes it may not be what providers like us to do, but our own patient groups and community members who have gone through treatments before have been a great resource. So that's what gravitated me to going to Brandi as a blogger. She's already tried a lot of information before. She writes it so eloquently. And we have other bloggers too. We have bloggers talking about things like LDN. So I can learn from their experiences. So we've had some amazing community members like that, even before public health. I would love to say some of the public health websites. I think I reference more of the American College of Rheumatology than anything else, but they all say something different with a definition of fibromyalgia, which becomes a challenge, because who do you utilize besides your own doctor? But if you're trying to train your own doctor, who that is. And I know you had a wonderful interview with Dr. Lipton. So like her book became the first book that I hand to people all the time. We need those reliable sources to come together.
And I know you've also been working with Swing Therapeutics and Stanza and exploring them in kind of clinical trials. I'm curious, Brandi, I know you started using Stanza, and I'm curious how you found it. And if you could talk actually a little bit about it, because I think it's interesting to hear how people are exploring some of these new treatments.
I was so excited because there was an update for it yesterday, and I was like, oh, I need to get back into this. I had a very positive experience. I was actually going through, again, a lot of, depression and stuff like that. And so it came to me at a really crucial time. And I was starting to work with a therapist through the VA to try to help me because, my body responds a lot to whatever I'm going through. So it not only just the food, but whatever mental stuff that I'm going through, it comes out into physical manifestations. And so my sister had recently passed away, and I was going through a severe depression with that. And so had a lot of fibro symptoms, and I didn't even think about it being fibro at the time. I was just like, what's going on with me? But I had a chance to do this app, and I loved it because I had never done meditation. You cannot see me sit down and actually focus on something or be in a quiet space because my brain doesn't do that. Like I was actually up the other night from like 12 to 4 in the morning walking around the house while everyone's sleeping because my brain doesn't settle when I have things on it. But this app was saying that it could help me like focus, and it could help me meditate and, help release. And like my therapist was trying to go through some things, and the two came together and really helped me how to calm my mind and be able to clear it out and be able to make space for the healing that my body really needed. And in turn, my body started calming down. And it was difficult at first because it was like, go into a quiet space and close your eyes and quiet your mind. I was like, how do we do that? And that was really hard for me to do. And it was definitely something I had to practice every single day, just not a lot of time, like 30 seconds, but then I was able to do it longer and longer. And I found myself, kind of lost in this space that I had created for myself. And my brain started calming down, and in turn, my body started calming down. And so I had a huge positive experience from it. And when it came to an end, I was very sad about it because I was like, I really want to continue doing this. And my therapist had tried to do multiple things. And I said, I've got this app that I'm working with. And he was curious about it and started telling him about it. And, it was just the way everything was coming together for me. I was just very grateful for it. I can't express how much it really helped me. But again, I had more of that mental aspect, and it was flaring up the physical stuff. And so you had to break that cycle. And for me, it was that app and just learning. And it wasn't just one way. It was showing, okay, let's try it this way. And we're going to try it this every day for a week. Okay, well, now this week we're going to try something else. And not everything worked, but when I found the tools that did work, I could focus on those things that did work and actually make that start working for me. And eventually I was able to break that cycle and be able to actually start having improvements. And so that was really important for me. It's just, saying, here's just one thing and you got to do it. It was like providing multiple things. We're all different people. Here are multiple things that might work. Let's find which one works for you. And I love that. I don't like being told what to do. So I like having that choice.
Yeah, thanks so much for sharing that. And I think, two things kind of stood out to me. One is, that personalized element where you're really trying to find what works for you, because everyone is different and what works for them is personal. And then the second thing is just thinking about those behavioral therapies that we layer onto other therapies, be that, movement or meditation or medication. And Melissa, I'd love to hear a little bit about, you mentioned like biohacking and kind of figuring out all those different behavioral strategies that worked for you. I'm curious how you started to kind of experiment with that and put that together, and when it ended up being most impactful for you.
It's a challenge because it's so multifactorial, and I've had to come to realize too how much stress has an impact, whether I like it or not, but definitely being biased because I saw a lot of changes with nutrition. But for me, I felt that was something that I could easily control with the least amount of side effects, and that I didn't need a provider to do it. I could do it at home if I learned to cook and use foods that would actually work best with my body. So I was able to make such a higher impact using nutrition. And then from there, seeing different changes. And I recognize I need to still work on things like sleep, because that made a difference when it was actually working a little bit better. So those aspects tied into it, and understanding how stress filters its way into all of the behavioral health, whether you're talking about nutrition or sleep, and just all the relaxation techniques. So I kind of had to layer it one at a time, start maybe with more of the nutrition because that was more intriguing for me, and then start to layer different things together to really make an overall impact in my health.
Dr. Chadwick, when either people bring some suggestions or research for behavioral therapies to you, or when you're kind of working out with them what that personalized plan looks like, what is that conversation like? How do you have kind of a successful conversation with someone?
Well, my standalone, and I've probably said this to y'all, and I've said it to all my patients, is I view fibromyalgia care as like 3 pillars of treatment. That may be a little bit simplified, but you cannot treat fibromyalgia in a silo. It involves a multifaceted approach. And so when people come to me and I can tell that they're needing assistance with maybe we have their pharmacologic needs taken care of, but there's other aspects of their life that are needing attention. Talking about things like nutrition, talking about things like purposeful movement, and then also just the impact that their chronic illness has on their quality of life. I would have to say, like, beyond medications, those discussions probably encompass 75% of my discussions with fibromyalgia patients, because as we all know, the amount of medications available to us to treat this condition is quite small. And many patients, although they may need some medications for symptom management, they're really wanting to take control and learn more about how to manage their condition day to day without a pill. And I'm just going to say that hands down, the majority of chronic pain patients, whether it be fibromyalgia or not, would prefer not to take medications to treat their conditions. And so I want to just lay that down as like the groundwork for when I see patients. And then it really just becomes an open discussion about where they feel their chronic pain is impacting their life most. And movement is difficult when a person has pain, but discussing exercise or just telling someone they need to go get on a treadmill is not a discussion that gets many people anywhere when you're talking about someone with chronic pain, especially fibromyalgia, who have central sensitization or actually get hyperalgesic from moving like the normal person. So having a provider who can understand these additional lifestyle modifications. And honestly, when patients come to me with ideas for their care, I never discount anything they may have read online or learned about in a support network. And I'll take that. And I'll say, you know what, I'd like to do research about what you're bringing me today. And if I can review this and see that there's data to support it, and it's not going to cause you harm, we can have a discussion about whether this is something we can move forward with. And I think so often providers get scared about things they haven't heard of. But I tend to push the box a little bit with my patients who may come to me with things that they've read about. And honestly, I've been surprised. Honestly, low-dose naltrexone was not something I had ever prescribed until a patient asked me about it. And I was nervous and I was scared. And I went to the literature and saw that it had randomized controlled trials to support its use. And the first time I prescribed it, I was nervous. But after I did that and I had my N of 1, I now have like N of hundreds. And it's been very helpful for people. And so for providers or even patients who are listening to this, the data can be out there. But even if it isn't, it takes a team to decide if an approach is A, safe, and B, worthwhile to pursue. But if it's not going to cause a patient harm, I think having that communication and that team-based approach is really important.
Yeah, and I wanted to kind of wrap up today's session just talking about community, because I think what you're talking about also emphasizes the importance of community on the patient side, but also on the provider side. And that's part of what we're trying to do here at Swing Care, is just educate providers to be able to have those conversations with patients, to be able to build up their knowledge of research into sometimes novel treatments, but sometimes just this baseline level of treatment today for fibromyalgia, so that we can really create a home for fibromyalgia care through that education and being able to work with the providers that we work with. But then on the patient side, Melissa and Brandi, I'd love to hear from you about what's exciting you at Support Fibromyalgia Network right now, what you would encourage people to do in terms of getting more involved, not only with their own advocacy for their own care, but also advocacy more generally, globally?
Well, we do have a lot happening in the background and behind the scenes. I mean, one of the big things has always been for the past couple of years since launching it was Advocacy Day. So taking patients, providers, researchers, and rallying to our representatives on Capitol Hill and letting them know we need to increase that funding at the NIH and get us a proper classification, because right now we get a lot of questions on what house does fibromyalgia live in? Is it musculoskeletal? Is it neurological? Is their immune system involved? So we need actually more research to get to the answers to that. We do a lot of patient education. Brandi, I'll let her talk more about the families program and a lot that she wants to do. And the big thing that we're trying to do and overcome the hurdles is the similar discussions like this. I would love to see, my goal since starting this organization is to see at least one medical provider in every state that has some familiarity with fibromyalgia, billable through insurance, and help support them. Recently, a new idea has come down the pipeline, and maybe Dr. Chadwick can talk me out of it. But if I did become a physician's assistant, I could train other physician's assistants around the country to support our medical providers as well. So we have a lot, and we want to support research. So we want to start to raise money for specific fibromyalgia research.
Yeah, and as far as families, there is a lot of stuff going on in the background, and there's just that triggered so many things in my brain. I was like, oh yeah, all these ideas. So you know, the biggest thing is just that fibromyalgia doesn't affect just the person living with it. And I know that we hear that all the time, but I think in families that really resonates, because when I was going through the diagnosis of trying to figure out what was going on with me, I was like not only disconnected from myself, but from my family. And so there was this huge gap. And so what I try to do along with Melissa is like, I try to tell Melissa all these issues that I've had personally, and like, how do we bridge that gap between the person living with fibromyalgia and their family? How do we get kids to process this? You know, like my kids can say fibromyalgia now, but when I was first living with it, they didn't even know how to say it. And so it's like, how do we get them to understand it of all ages? How do we get them to deal with it? You know, what's it like living with fibromyalgia, like with the parent that lives with fibromyalgia? Then you got the caregiver, you know, the partner that is trying to support the person living with it. So there's a lot of stuff that we're trying to just work on and try to figure out how we can get that. But as far as advocacy, I just want to say a personal note is that the word advocacy is just so strong, and it's so intimidating, it's so powerful, and it's so impactful. And like I said, I never thought that I would ever become an advocate, because I always looked at it as this word that was like, that's something that I want to do, and I wish that I could do, and I could never do it because there's just so much that goes on to it. And then I just woke up one day and was like, oh, I'm doing this. This is a lot easier than I realized. And I think there's a lot of people out there that's already doing advocacy that don't even realize they're doing it. Just sharing your story, or, you know, being able to share some of the workshops that we have within the fibromyalgia community, not just with Support Fibromyalgia, but, you know, the webinars that we see, sharing that. Supporting someone that lives with fibromyalgia. When I was first diagnosed with fibromyalgia and I had a friend, didn't even know what it was. What I didn't even know is that she went behind the scenes and looked it up and tried to find ways to support me. There's just all these different ways that we can do it without, you know, you don't physically have to go down to, you know, the DC and do those things, because not all of us are physically able to. So don't discount yourself and what you can do with advocacy just because you think that you can't do it. Don't let your mind stop you from doing something. There's always ways that you can get involved. And if you don't know how, reach out to me and Melissa. I can guarantee you're already doing something. So advocacy is very powerful. So be a part of it, and we can all do this together. It's all about community and doing it together.
That's why Brandi and I are so balanced when it comes to this types of information, because I think a lot of the foundation we set, when I told Brandi when we first met, she thought I was a spammer, but I had to be persistent to meet her in person, just because of my past training of doing street team grassroots marketing. I like to meet people, even as an introvert, in person. But our goal here is to pick people up. So all these advocates around the country, and I'm calling them advocates, but they could be support group leaders, bloggers, medical providers, anyone that wants to join into the fibromyalgia community and help it. We want to support all of you, because then you can support the people you're already supporting in a better way. So that's why we always say, from the Mosh Pit Queen, which was my name before this, when someone falls down, we pick them up. So we're going around the country, we're picking up people, and now internationally too. So it's a big deal for us.
Absolutely. What an awesome note to end on. Thank you so much for being here. I'm so glad we got to have this discussion. And I think a theme that came out of it was, the language that we use is really powerful, and just understanding advocacy from any level is so important when we're talking in this fibromyalgia community. So thank you again. Really hope you all enjoyed the discussion, and look forward to chatting again soon.
Thank you. It was amazing.
Thank you.